Welcome, everyone. It's fantastic to have you all here again. This is actually super cool. I'm quite looking forward to this in the kind of classic PN fashion. We're trying to address something, lots of questions that we've received, a lot of questions that are in the industry, and in particular, how to cut through all the clutter that is being shared around this new weight loss tool that we have available to us. So today we're going to be talking with Dr. William Yee about things all related to GLP-1s. And as we kind of think about that, you might be sitting back and wondering, okay, why this guy? Well, Dr. Yee is a board-certified general surgeon who specializes in bariatric surgery, colon and skin cancer treatment, thyroid disease, skin lesions. He's experienced in traditional surgery and minimally invasive and robotic assisted surgery for various health issues. Everything from hernia repair to gallbladder disease to appendicitis. He's also an accomplished academic instructor and researcher with publications in peer-reviewed journals on topics including laparoscopic. I don't even know how to say the second part of this one here. Help me say this correctly, Dr. Yee. Yeah, thank you. Small bowel obstruction and bariatric surgery. So I think you can see here as we think about how do we find and bring forward the best possible experts to share the best possible research-based information with you. Doc has been willing to join us and kind of walk us through a whole bunch of questions. So for us, as we kind of think about this, from a PN perspective, we've had tons of questions crossing the spectrum. We want to cut right to it and address all those. How do we see these new class of medications, which we're going to hear, they're actually not a new class of medications, and how do they fit with our roles as health and fitness professionals? And so that's what we want to talk about today. With that, I think we're going to dive right into this here. Dr. Yee, can you share with us what are, let's go back to basics here a little bit. What are GLP-1s and are they different from traditional weight loss medications? Just walk us through kind of a general overview of what these things are.
Yeah, GLP-1s are a class of hormones called incretins. Basically, we've been studying them for probably 30 plus years now. There are other ones named ghrelin and PPY and various other hormones that we've been studying in terms of regulating appetite, right? What types of hormones make us feel hungry and what other ones make us feel full, or satiety is the word that we use. And they've been around, like I said, we've been studying them for about 30 years. And GLP-1 we actually knew about probably 25 years ago, and that we knew that this hormone basically made people feel full and they were less hungry. But the problem in terms of turning it into a medication actually was that they are very, their half-life is short, meaning that in your system, they basically come on and they're gone. And so the real question was, how do we get it to a point where they can last for a long time in your system to actually cause the satiety that we want for weight loss? And that was achieved probably 20 years ago. But really the key kind of like market where these drugs were first used was for diabetes. We found that these medications controlled your blood sugar levels really well. And that makes sense because in healthcare or in medicine, there's something called metabolic syndrome, which is that when you're obese, obesity isn't it's the overlying issue, but it causes things like liver disease, high blood pressure, high triglycerides, cardiovascular disease. And so diabetes was kind of where it was targeted from. And then within the last probably 3 or 4 years, we knew that it was causing weight loss in our patients who are diabetic, but really the FDA approved it for weight loss within the last couple of years. So that's kind of the story of where GLP-1s came from.
Okay, so right now, today, what are the most common GLP-1s and are they different from one another? If so, how are they different?
Yeah, the common names that you'll hear are Wegovy, Ozempic, Mounjaro, Zepbound. These are all similar class of drugs, but the Zepbound and the Mounjaro are something called tirzepatide, which is actually a GLP-1 and GIP agonist. So when you hear GIP, that's just another type of incretin, like I said before, broad classification of these hormones that help you regulate your hunger levels. So there are small differences, and really the big difference about this tirzepatide is that it seems to cause more weight loss than the semaglutide or the Ozempic Wegovy that you hear about. Those are the two kind of broad classes or four names, again, depending on who you're using, Eli Lilly versus Novo Nordisk, that are in existence right now. There are more coming down the pipeline, but I won't get into that.
Gotcha, gotcha. Well, I might ask you about those in a little bit later on here. So, if you were to kind of sit back and say there was a number of different effects that these have on the body, but how? And it sounds like one, you might see some more weight loss than others. Um, how exactly do these work to promote specifically weight loss versus the other things that you were describing?
Yeah, so what happens is GLP-1, what primary effect is it causes your small intestine to feel full, right? And what's interesting for, I think, the people who are on this talk is that, and can get into this a little bit later, is that GLP-1 makes you feel full. And they found that in some studies that stressful exercise, like if you did an intense HIIT workout, that your actually GLP-1 levels are increased for the first couple hours after that exercise, right? Which is
Oh,
fascinating
right,
to me
really?
because just in an anecdotal experience, like if I had an intense workout, even if it's around the time that I usually eat, I'm not really hungry for those few hours afterwards. I know I should eat, but I'm not hungry. So it'd be curious to see whether future studies dive deeper into that. But yeah, their basic mechanism is that they signal your small intestine to say that you're full. They do that by also slowing down gut motility. So they make your stomach and your intestines what we call peristalsis, which is the kind of worm-like effect that moves food along. It slows that down, and so you feel full for longer for that reason.
Got it, got it. So when we sit back and actually I'm going to pause for one sec here. I meant to say this a little bit earlier on. Apologies. At the bottom of everyone's screen, there is a Q&A button. It's harder for me to kind of follow along as we go through the chat for questions, but if you drop them in, I've got the Q&A right up here on my right-hand screen. And so I'll be able to ask, we'll be able to ask questions that pop up in there. So if you've got questions, feel free to pop them into the Q&A. So coming back to what we were talking about here, we've talked about how these things work, and given your background, it's interesting. I noted here that you're also a bariatric surgeon. How do you think about the role of bariatric surgery and, as we were talking before, and GLP-1s? What are some of the similarities in kind of a program that people were on? Just walk us through that a little bit.
Yeah, so one of the main reasons, so when bariatric surgery first came out, there was this thought that basically, so bariatric surgery broadly comes down to either you get a sleeve or something called a bypass. There's some newer surgeries that are out that people are doing now, but I won't deep dive into that. But essentially, what we thought was that there was this mechanical change that we were creating in the stomach, either making the stomach smaller or we were bypassing a segment of your intestines so that you were eating less or absorbing less of what you did eat, right? But really, what the studies are showing is that they work through a lot of the same mechanisms that GLP-1 agonists do, which is that they're creating hormonal changes that, for example, after bariatric surgery, your GLP-1 levels are higher. And so they basically work in a lot of ways in the same fashion. Now, when GLP-1s were approved for weight loss, a lot of bariatric surgeons were very nervous that they had trained to do these surgeries and now their market was going to be kind of eaten into. But really, that's not the case, right? We have a lot of patients who are who have bariatric surgery, and that for whatever reason they don't make the necessary lifestyle modifications, end up regaining weight. And so for those people, what do? Well, now we have a GLP-1 agonist. And for patients who can't stand to be on GLP-1s, or they're not willing to pay lifelong sums of money to be on these drugs, well, then we have bariatric surgery. And so again, they kind of work in synchronicity. And on top of that, I think ultimately as physicians, our ultimate goal is achieving the best health for everyone, right? And so this is just another kind of tool in our armamentarium in terms of fighting obesity, which is, the leading cause of disease in our country.
Yeah, yeah. So when you sit back and you think about, okay, you've got your practice, you've got a number of different potential options for patients. Who are ideal candidates for these medications from your experience?
Yeah, as a surgeon, I think the ideal candidate is anyone who's tried weight loss, has tried to lose weight on their own, who's tried to have physician monitored weight loss, who's tried exercise programs and it's just not been successful. I don't think it should be the first thing that people turn to, but people who have generally shown a desire to get there and tried multiple other avenues that haven't been successful, I'm happy to give them an option that will allow them to be healthy.
Okay. We had a kind of question pop up here, so a little bit more nuanced is for people who are looking to lose 10, 15 pounds, is this a reasonable path forward? How would you think about that?
Yeah, again, like I said, I think if you try it on your own and your goal is even whether it's 5 pounds or 50 pounds, I think these drugs are useful to help you get there. And once you get there, I mean, the individuals on this call will probably know this is that it's hard to get started on weight loss and exercise and making lifestyle changes. But the funny thing is that once they start getting to a place where they're feeling healthier, things like exercise and diet become actually, it builds on itself. It's almost logarithmic in my mind, which is that as you start feeling healthier and exercise starts becoming fun rather than a chore, you start feeling good from eating better and exercising better. It almost takes a life of its own in terms of your lifestyle modifications. And these drugs can help jumpstart that process in my mind.
Got it. Got it. So, when you sit back and you're evaluating a potential patient for these medications, are there specific kind of red flags that you pay attention to or coaches should pay attention to?
Yeah, I mean, the biggest thing, from a side effect standpoint, these drugs slow your gut motility, right? So they slow down your stomach and they slow down your intestines from really moving. So I think the biggest thing are patients who have reflux is one, right? So reflux is basically heartburn, the commonplace name, which is acid, but basically coming back up into your throat and having chest discomfort or various numbers of other symptoms. Those patients, probably I would try other things before trying GLP-1s. And then in terms of like, I guess what you're referring to are like, what are psychological red flags and things of that nature?
Any sort of red flags that yeah.
Yeah, I don't really know if they're red flags per se. The studies have shown really that if you have a history of thyroid cancer in the family, that maybe you should stay away from these drugs because they do seem to slightly increase your risk of thyroid cancer. But there really aren't any true kind of like, if you have this, you should not be taking this drug. Red flags, as you're saying.
Yeah, got it. So, a little bit different. Obviously, you're a trained physician, and so how you think about this would be different than us as health and fitness coaches. How can we, as coaches, determine if GLP-1s might be an appropriate option for a client?
Yeah, for your clients, as I was saying before, is that when patients have tried, exercise and diet, and you're working with them, and it's been like 6 weeks, let's say, and they're just not progressing at all, right? And there's a number of reasons that can happen, right? People's lifestyles are busy, they are motivated, but they just can't help but, they're after work, they have to now drive their kids somewhere, or they're picking up individuals, and they know that they should be eating a meal that they cooked at home, but it's dinner time and they got to feed the kids, so I'm just going to join in on this a quick McDonald's bite. Those types of things happen. I mean, they happen in my life. They happen in everyone's lives. For those individuals, this can help kind of quell their desire for that quick meal, that quick fix, right? I have a friend, actually, he's an orthopedic surgeon. His wife started GLP-1s, and she finds that a lot of times, like, she doesn't want salty, sugary things. Like, she wants some water and she wants kind of vegetables. There's something more than, and we don't know this for a fact yet, but there's something even on a psychological that's happening with these GLP-1 drugs. Some of the anecdotal stories that we hear are that people smoke less, they're drinking alcohol less. So there's something happening with GLP-1s that basically knocks out that basic kind of craving desire that's occurring. And we don't know much about craving, right? What is that? What biochemical level? But clearly these GLP-1s are helping with that. And so for me, with your clients, it would be that, you're stalled out, you're not making any progress. What else can I do? Well, then GLP-1s may be an assist for that.
Got it. Okay. Thank you very much. Now we're going to get into an interesting section here. So there are tons of misconceptions. You've got the media saying, everything from the super positive to the super negative and everything in between. I want to work with you here to debunk some of the most common myths. And there's this idea GLP-1s are going to replace the need for health and fitness coaches and weight loss management. You and I chatted about this before. Thoughts? Just kind of share.
Definitely not. If anything, it will increase the number of people who are searching for diet and exercise options. It may even be a kind of on-ramp to people seeking out diet and exercise options moving forward who never really thought about it. As I was saying before, once patients or once clients start seeing some benefits of weight loss, they seek other options to keep that momentum going. Like, it's addictive, right? Exercise is addictive. It's the craving aspect that we were talking about before. The problem is that when you're overweight, it's really hard to feel good even when you work out. Like, your body's just not used to it. You're kind of beat up. You're feeling like, for even my own personal experience with patients, is that they just feel tired, right? They don't feel that kind of lift that people who are every day working out get. But if we can get them there, like, more and more people will seek out these things. So to me, it's not going to replace any coaches, nutritionists. If anything, it's going to find more patients for them. And the same happens with the bariatric surgery. If anything, the people that we do bariatric procedures on, we ask them and we give them options to find out, coaches, to find a nutritionist, if not provide them ourselves. So if anything, it's going to build the client base for the individuals on this call.
Gotcha. Okay, so here's that's one big one. The next biggest one, maybe equivalent, is, Doc, these are a cop-out. It's just an easy way out for people avoiding doing the harder work. Thoughts?
I mean, that makes me really angry, right? It's that we're not in a competition. We are not. It's not the easy way to what? To better health. We're not competing against one another. I mean, there may be a part of that in just our basic kind of the psychology of human beings, is that we see everything as a competition. Maybe that's also societal in the United States. But really, like, if we're trying to achieve better health, you do whatever means necessary in a safe way to achieve the goals that you need. Like, I want you to be healthy. Why should, your partner feel like you're cheating at something? That's ridiculous in terms of the way we think about health.
Yeah, I mean, I really enjoyed when we were first talking about this earlier on here. I think I've looked at some of this and heard this idea of it's a cop-out, it's cheating, it's something along those lines. And cheating assumes there's a game, some sort of game that we're playing. Whereas if I redirect this to, ultimately our goal here is to increase the overall health of society at large. And the fact is, we've seen it decline and continue to decline. So I can't quite appreciate where all this Well, I can appreciate it, but where this is coming from, that's a cop out. It's easy. It didn't make it, we're making something hard. The fact is, describe for me like what you did earlier on is the entire food industry is designed to stimulate us to have a stronger desire for food that they're selling for a profit. And we
Yeah,
have
I
a,
mean,
yeah, go
this
ahead,
is
please.
something I'm very passionate about, which is that the food industry has basically synthetically designed foods that will make you crave, not feel full, but are asking for a dopamine hit because you ate something super salty or super sugary, right? So you can say that you're kind of this is unnatural, that you shouldn't be taking these drugs, but the truth is that most of the foods that we eat are unnatural at this point. And so to me, we're just combating a synthetic um, diet plan that the food industry has designed for us and trying to get back to kind of baseline normal. So a lot of some of the questions I get are, will this make me not feel rewarded when I eat? It may not make you feel rewarded in the ways that you were before, but I would say that that's probably like you were addicted to a drug that the food industry has given you. And so maybe what we're really doing is getting you back to what normal should be. Um, yeah, and so to me, any tool that helps fight off these, you know, fight off these cravings for things that your body doesn't really need, I'll take it.
Yeah, yeah. I think yeah, I think there's certainly a role for these to play. And I think, as we talk about this, the whole point of the discussion here today is about the role of GLP-1s, what's the background, so on and so forth. What we're not saying is this is a be all and end all for everyone all the time, but
Right.
this is the main thing here. And so I'm going to jump into some of the other questions that popped up here is um, this idea that you need to or you don't need to exercise when taking GLP-1s.
Yeah,
Yeah,
so there's so much to say about this. Well, I'll just start with what the data shows. So the data shows that you can lose weight without diet and exercise on GLP-1s. For the most part, your diet, you will eat less on GLP-1s. And so if you keep the same amount of activity, you're going to lose weight. But what the studies also show are that when you add diet and exercise, you get 2.5x the amount of weight loss. So you lose more weight and you lose it faster. So clearly, diet and exercise is still very important. And most interestingly is that these drug companies are peddling these medications as a lifelong medications, right? And that studies do show that if you, after a year, if you come off the medication, you will likely regain the weight that you lost while on a GLP-1. So at year 2, those patients regain the weight. However, for patients who maintain a diet and exercise program after year 1, while being on GLP-1s, what they find is that those individuals maintain the weight loss after coming off a GLP-1 at year 2. So what I think we're going to start finding is that you can start with the GLP-1 and stop it, and if you keep up with the necessary lifestyle modifications, you can maintain the weight loss. So to me, I think where the future of GLP-1s are going to go is that it's really going to be, like I was saying before, a jumpstart medication. And if you can make the changes that we were talking about before in terms of lifestyle, you can maintain the weight loss and not have to take the drug anymore.
excellent. So now we've talked about weight loss, and I want to dive a little bit deeper, or kind of break this up a little bit more. Um, there's the idea of weight loss and then muscle loss, so fat loss, maintaining muscle mass. And so, can you talk through a little bit about that? Because as I understand it, one of the big risks here is people go on these medications. They're not looking at nutrition. They're not looking at exercise. Yes, they look down at the scale and it's great, but in some cases they've lost, half that or more than half of that. It's been muscle loss. And there's increased risks over time with that, maybe even more so than where they were before. And so, how do you think about this from kind of patient management perspective? And as a coach, a role that a coach can play.
Yeah, I mean, we see this in bariatric surgery. Muscle loss is very evident even in the surgeries that I do, right? And so, but when we do bariatric surgery, they're enrolled in a full program right? We follow these patients for 2 years. I see them for 6 months before surgery. We try weight loss without needing surgery by coaching them, getting them a nutritionist, trying to encourage them to exercise. If they still don't make it at 6 months, then they're approved for surgery. After surgery, we still have a nutritionist follow along. We have psychological support. We have individuals encouraging them for 2 years afterwards. And to me, if you're on a GLP-1, that is one of the things that you need, is that you need someone who can teach you about diet, about what vitamins should I be on, how do I ensure that I'm getting enough macros, right? Just losing weight is great, but if you're losing muscle mass, which is a common, not side effect, but a common kind of sequelae of eating less, you have to change your diet. So you need much more protein than you're probably getting before, right? Because most of your diet may have been, you probably were proteins insufficient to begin with, actually, or for some patients. But yes, so for that, you need to ensure that they're getting adequate amounts of protein. And a lot of studies are being done on a specific type of protein, HMB proteins, which basically has been shown to increase muscle mass. And I was talking about the future of these medications. One of the drugs that they're coming down the pipeline is GLP-1 agonist that's combined with protein or hormones that increase muscle mass to kind of ward off these not side effects, but sequelae, as I was saying before.
Got it. Got it. And then I'm assuming a role in conjunction with higher protein intake, strength training, resistance training too as well. And this is definitely where coaches can have a substantial role.
For sure. If you just eat protein, if you don't utilize that and build muscle off that, like just because you eat a bunch of steak, right, doesn't mean that necessarily turns into muscle. You actually have to utilize it and build the materials of your muscles. And so, yeah, you would need diet and exercise. Whenever I say diet in my mind, that is in conjunction with exercise. I don't see it as like two separate things in terms of achieving the goals that we're talking about.
Gotcha. And somebody asked, what kind of protein did you say that
Yeah, HMB.
Gotcha.
You'll see if you do a quick Google Scholar search on these things, you'll see some studies on it. We utilize it actually where this all came from is that in critically ill patients in the ICU, in intensive care unit, HMB protein was being studied to help build muscle mass in these patients who are bedridden.
Got it. Okay, and so what are talk us through the side effects. So we were talking before, kind of there are some side effects when people first start. Same thing with bariatric surgery. There's some side effects there. Walk me through some of the common side effects, and then how do you think about those from a nutrition perspective?
Yeah, the biggest one's nausea and vomiting. Most commonplace one, nausea and vomiting. And is it a side effect? Not really. I mean, the symptoms are, but really they're basically slowing down your gut. And so I think that what people are having problems with is that they're not drinking enough liquids. They're not, they're still maintaining the same diet plan that they had before, right? And so really when you're slowing down your gut, it's more important to eat small meals consistently throughout the day rather than getting 3 square meals as kind of the food industry has dictated to us. And just getting accustomed to that will help those specific symptoms. And what I find in bariatric surgery is that, we were talking about this before, but is that when you have a bariatric patient and you do surgery on them, almost 30% of them have nausea and vomiting within the first 2 weeks after the surgery. And that's either their body acclimating to their new architecture of their body or their diet that they're not sticking to at home. And once they kind of get out of that phase, those symptoms generally get better. And I have a feeling that that's the same thing. That's the same with these GLP-1 agonists, is that a lot of the nausea and vomiting will improve if you stick with it. The problem is that with surgery, once you have the surgery, you can't go back. And so some of those patients end up in the hospital, as you might have read these New York Times article about GLP-1 agonist individuals and showing up at the hospital with intractable abdominal pain and nausea, vomiting. But with surgery, we have a lot of those patients who come back and are hydrated in the hospital after their surgery. And then a month later, the symptoms are gone and they're doing great. And so to me, again, I don't have the data to back this up, but I have a feeling if you're able to fight through some of these side effects, you'll be able to be really happy long-term with these drugs. The other kind of side effects that we see, we've talked about the muscle loss. The other thing that some patients experience is alopecia, so hair loss. So
Yeah.
hair loss happens when you don't eat enough protein. And so again, the fix there, diet and exercise, basically ensuring that you're getting enough protein. The other ones that you may have heard about are things like pancreatitis. That really hasn't been shown to be the case in studies. Gallstones, there is a 1% increased risk of gallstones forming when you come on these drugs. But that really happens with anyone who has weight loss. So when people who lose weight very quickly, gallstones is a kind of a sequelae of that. And so it's not really GLP-1 specific, but those are the big ones.
Gotcha. And so one of the things we've talked about is, in the early weeks, from a coaching perspective, if we're helping people with nutrition as it relate to this, managing fat intake specifically to help manage some of those symptoms. Is that something you've seen? Is an approach you take? How do you think about that?
Yeah, I'll say that most patients who are on GLP-1s, their desire for fatty foods dissipates. It goes away.
Yeah.
I think it's really more about the volume of foods that people are eating, which is that, again, the whole reason why you have nausea and vomiting and abdominal cramping is because you've taken too much food on and it's not moving, right? These drugs work by slowing down your gut. And so if you've taken too much volume, you're going to get sick because things are not moving through. What we call ileus, which is the small bowel, or gastroparesis, which is the stomach.
Got it. Okay. So I want to jump into a little bit now. We have coaches that are going to be supporting clients or are supporting clients. And, a number of people have come through who have coached some clients, and we've talked about some of the things that they've run into. Is like, so how from a coaching perspective, how might the strategies change based on, I've got three different scenarios here. One, as a coach with a client starting GLP-1s, I think we've touched on all these, but we'll kind of make sure it's kind of clear and actionable.
Mm-hmm.
Or a coach that's working with someone who's currently using a GLP-1, so been using it for a little while. And then a coach who's working with someone who's finishing their course of GLP-1s. How would those coaching strategies be different between those categories, and what would be the same?
Yeah, for the patients who first starting, it's going to be the nausea, vomiting symptoms the side effects or the sequelae that people have. Yeah. And basically there, you're going to be teaching them about having smaller meals throughout the day, how to make sure that you're consistently hydrated. For those individuals that are been taking GLP-1s, it's basically ensuring that they're getting enough macros, that people, if they want to be safe with these drugs, you're going to have to be documenting, right? No one likes to be an accountant for their diet, but it's really important if you're going through this process. You need to be marking down and ensuring that you're getting enough vitamins and protein, and then keeping up with exercise. Online, you'll see all kinds of people on Reddit or Facebook groups talking about, I lost this much weight in 3 weeks, yada, yada. I lost 35 pounds in 2 weeks. 35 pounds is great. Again, it's not a competition, but it's also maybe unsafe. Like really, we're more concerned about long-term outcomes, right? And if you're losing 35 pounds in 2 weeks, 3 weeks, that may be a little bit unsafe. And so you need to be involved in terms of coaching them along about what's safe, ensuring that they're getting to a place where they're happy, but also safe in terms of their body long-term. And then for patients who are coming off GLP-1s, technically the industry will tell you that no one ever should be coming off GLP-1s, right? This is a medication that's being touted as like you need to be on it long term. But really, I think it's about are you ready to come off GLP-1s? Meaning that are you up to date in terms of your nutrition and your exercise routine that you're safe to come off this without being likely to regain the weight. So now you regain the weight at year 2 and you're basically back to square one. You've wasted all this money, you've wasted all this time and effort. And so coaching those individuals in terms of ensuring that they're in a good place to be ready, I think is what I would focus on near the end.
So what I'm hearing for that last group is ensuring that these individuals have developed sustainable, healthy habits in their life as it relates to exercise, nutrition, sleep, stress management, all the things that you said that allow people to come off these medications and still maintain their weight loss. Really, really
Yeah,
interesting.
and what I would tell you for the clients of the individuals on this call is that, there are people who are very successful with weight loss, right, and exercise, and they're doing great. But you're meeting with them once a week, maybe twice a week. You're laying out, again, I don't know how everyone on this call does it, but you're laying out nutrition goals for them, maybe even a specific diet plan about what they should be, an actual diet plan every day about this meal you should eat this, that. They come off it and they regain the weight. There are other individuals who are basically running on their own, doing a great job, and you're still kind of coaching them, but you don't really need to be coaching them, and you feel that in your heart. A lot of this is basically you're going to have to figure out, know your patient or your clients really well to figure out, because I can't just say like, oh, this person's ready, this person's not, just by looking at some data. It's got to be basically on a personal level. Like, this person, you've been working with them for however long. Are they really ready to come off GLP-1s, or are they kind of, because of all the other things that are going on, they're doing okay, but if they come off it, they're just going to nosedive again. And so I think it's very tailored. I think you need to understand your clients really well in order to figure that out.
Excellent. There's some interesting questions coming up in and around. We've talked a little bit about tracking, and one of the things that we teach as we go along is teaching people about their hunger cues and to become aware of their hunger cues. My guess is that with GLP-1s, you start to in the earlier part, you're going to have some interference with being aware of those, and hence why it sounds like some of the tracking stuff is quite important. And so you want to talk a little bit about the importance of tracking. I think particularly as we talk about protein intake and different things along those lines. How do you think about that, and how can coaches play a role there?
Yeah. So again, my friend's wife. So my friend is an orthopedic surgeon,
Yeah.
and played basketball growing up, lifts all the time, very into nutrition, whatnot. Wife, not so much. Wife started GLP-1 agonists, maybe in, I want to say May, June region, and they were going to dinner, and he would turn to her and he's like, "You barely eaten anything." She would just say, "I'm not hungry." And he actually got very nervous, got very scared, because he felt like she was actually malnutritioned. And I told him, well, are you tracking proteins and things like that? And he's like, well, what? No, but that's a good point. I think that's a common thing, is that when you take these drugs, yes, those cues kind of go away. And in order to stay safe, you need someone. If you can't do it yourself, you need to find someone who's going to help you kind of track these things and monitor how much protein you're getting. Yeah, protein is the key.
Got it. Got it. So we talked a little bit about this idea of kind of people coming, if they're potentially coming off the medications. Do you have a protocol like where you would kind of bring people down slowly off the medications?
No, so from a medicine health, as a doctor, that's not, you don't ever come off GLP-1s, right?
Oh,
The
okay.
data doesn't show that. What I'm saying, and look, again, these drug companies, they don't want you to come off the drug, right? Like, that's how they make money, is that this is a
Yeah,
lifelong medication you're gonna have to
yeah,
take.
yeah.
But my inference from what the studies are showing, right, the research is showing, is that there's a potential, if you make the lifestyle modifications, you probably can, right?
Gotcha.
But that's not kind of what the health and drug industry will tell you, because that's not how they're marketed. But my personal inference from the research shows that yes, but it requires a lot of health, exercise and diet.
Got it. Got it. So as we kind of sit back here, I'm gonna dive into some of the other questions that have come about here. So I'm just jumping into the Q&A. There's some questions around indications. Are there any age restrictions as it relates to GLP-1s from a indications perspective?
Yeah, from an age perspective, I think that right now, I don't think that people are giving them or to adolescents or children, right? Anyone under the age of 18. The same thing happened with bariatric surgery, but for bariatric surgery, for those who are morbidly obese with BMI and super morbidly obese, BMIs over 40, those patients actually, and what we're finding is that it does work for those patients, and they do great. But there's a nervousness, anything to do with children, right, in terms of development and growth, especially when we're talking about nutrition. So
Yeah.
at this point, I don't think we're giving them to those under 18.
Gotcha. But over anything above and beyond that, there's still.
Yeah.
Gotcha. If we're looking at, let's see here, some of the other questions are coming around long-term side effects.
Yeah, long-term side effects, they're really, again, we've been studying this drug in diabetic patients since the 90s, right? So there really aren't major side effects. It's really the nausea, vomiting, abdominal cramping that's the big issue. But that's something that can kind of be mitigated over time. Or if you don't, I've been hearing of people overdosing on GLP-1 agonists. There's not really such a thing. It's not like, you're going to go have a seizure or whatnot. You're going to have a really bad stomachache probably, but that will go away.
Gotcha. Somebody asked about kidney stones. Is anything there from a higher risk for kidney stones?
No. Again, gallstones, yes. Kidney stones, no. Gallstones are formed in the gallbladder. That word that you were talking about, cholecystectomy, that earlier that you had a trouble pronouncing, that's basically the surgery to remove your gallbladder. So
Gotcha.
that's just
Gotcha.
going back to that.
Gotcha. There is one a little bit we talked about here, in and around vitamin deficiencies. You had said here, so the potential, if people have less desire for fats, potentially, I'm not relating that to vitamins, but obviously vitamin storage, as we're thinking about some of that there, and just lower caloric intake, from a vitamins perspective.
Yeah, if you take
Yeah.
what I was going to say is, so yes, so the fat soluble vitamins are A, D, E, and K, right?
Yeah.
And basically, what we see is that a multivitamin will handle that. So every patient who has a bariatric procedure, they're on a multivitamin. Ours is bariatric specific, but even a pre-pregnancy vitamin is useful. Basically, again, a lot of it comes down to monitoring and ensuring that you're hitting 100% of all the kind of nutrients that you need for the day. If you eat just a little bit of fat, you're going to absorb your fat soluble vitamins. It's not like we could cut down probably 90% of the fat that we eat and still be just fine.
Gotcha.
Yeah. So tracking, again, I understand that eating should be pleasurable, but if we're talking about natural, like really food is we eat for energy, and kind of the mechanism of taking pleasure in eating was nature's way of ensuring that we had a signal to want to continue doing it, right?
Yeah.
But in truth, the end goal is essentially just getting the maximum, all the nutrition that you need to perform your everyday activities of life to achieve good health. And so I think I'm ranting about that mostly because that's my own personal passion project to tell people about we need to rethink how we approach eating. But I've gone off a little topic there. Sorry.
No, it's quite all right. It's quite all right. So I'm gonna pause for a sec because what just to summarize here is what I've really appreciated you kind of sharing the role that you see and what the industry would like, and of course they would like us to be on forever. I mean that's it, profit into oblivion, right? But there's a very clear path for people to come off these, and so the roles we think about as a coach, we can support people as they're on these medications, help them build sustainable, healthy habits to move off the medications and continue to maintain what they've already achieved. There are specific recommendations we can make as coaches to help people get the best, most effective results from these medications. And I think one of the things I'm noticing through the chat here is there's a fantastic role for health coaches to play in the support of these types of patients. And one thing I do want to continue to reinforce, we're not advocating this is like the be all and end all for everybody all the time. What I think is this is another tool that makes a very hard thing, quite frankly, less hard. I'm not even going to say easy. It makes it just less hard. And so if you can help people with portion control, you can help people start to see incremental changes. This does not replace all the necessity for helping people from an emotional regulation standpoint, from our deep health framework, from the psychology or the psychological aspects of behavior change in the development of healthy habits. There are a number of things around the relationships that people have, the emotions, the stress, all these other drivers of the lifestyle choices that we make. But if we can add one tool that makes this very, very hard thing a little bit easier, I think it merits discussion. Again, not for everyone, but it certainly merits discussion. And so what I want to shift away from is this idea of it's either this or either that, but what is the role, what kind of person, and how can we as coaches support people as they navigate this? These things aren't going away. And in fact, they're another tool for us to help counter the literal billions of dollars that are going into the input, the calorie input side of the equation. So I just like to kind of provide some of these summaries as we think about these. Tell us a little bit about the future. What does that look like right now as we're as we look to the next, call it 5 to 10 years?
Yeah, I think the most exciting thing from my perspective and from medicine, general medicine perspective is we were talking about the psychological cravings and the desires. Is that this data is coming out that the patients who are on these drugs don't smoke anymore. They don't want to drink alcohol anymore. And so there's clearly a psychological component that's occurring with these medications, these hormones as well. And to me, that's fascinating, is that will GLP-1s be used to help with, nicotine addiction in the future? Will that be a prescribed reason for why you take these medications? The psychological component is the most fascinating to me. In terms of its influence on weight loss and kind of health, there are people are designing these drugs in combinations with other things that they create, right? So as I was saying before, joining it with a drug that reduces sarcopenia or muscle loss. Hopefully they have another medication or another drug that they can attach to it that will decrease hair loss. Those are all the things that the drug company is tinkering with at this point. Yeah, that's really the future. But to me, the psychological aspects are the most fascinating ones in terms of, because as would relate to the individuals on this call, is that if these drugs can also make you do other healthy things in your life, maybe these drugs are actually useful for everybody, right? So will they increase the number of clients who will want to exercise, who want to do healthy things? That to me is fascinating.
Excellent, excellent. All right, we're coming near the end here, but I did see actually a couple questions pop up that I might jump in here. Nutrition related. Probiotics was one, and
Yeah.
the other one was any concerns about fiber intake?
Yeah, so fiber obviously has been known to kind of slow down your gut motility so yes, I think that data in terms of fiber and probiotics and what are the other things that I've been seeing on, there are a number of other things that supplements that people have been talking about. I don't have any hard data to say either way, whether it's useful, whether it can counteract certain things. That research still has to be done. And to be frankly, I don't know if it will be done done in a meaningful way, because usually you need financial motivation in order to do some of these projects. But I mean, yeah, I don't really have anything to say on that from a health perspective.
Yeah, got it. All right. So one of the key things I wanted to let you all know about today is, as you'll see here, Dr. Yi works with an organization that's helped sponsor this kind of educational piece for us here called Orderly Meds. And in conjunction with Orderly Meds, they provide telehealth access to individuals like Dr. Yi that can help clients on a GLP-1 journey. And so through them, we have a program that they've offered for PN coaches. I want to be crystal clear on something. We get nothing out of this. So there's some questions that people will have. Oh, well, you know, the common things is, oh, they're partnering, there's money, so on and so on. There is literally nothing. The fact is, as I sat back and looked at what's happening in this industry, there is a bit of a disconnect. So, you know, some of the bigger gym chains you'll see are now offering these services across the board. We wanted to figure out how can we both educate our community and provide them with an opportunity to help their clients using these new tools. And so we have a program for you that is specifically from Orderly Meds for PN coaches. So if you're interested in that, and again, it's entirely up to you, makes no difference to us, but there's an opportunity for you to add a new tool to your toolbox. You'll receive an email on the program following the webinar. I have also posted it in the chat just now. It's at the 12:53 time point if people are looking for it. And you can go there and learn more about this. And basically, it's super simple. You're going to get valuable resource, a valuable new tool to be able to help your clients. Again, nothing involved on our part, nothing required, entirely up to you. And that has been a really, really cool opportunity that we wanted to bring to you on behalf of Orderly Meds. And in particular, most importantly, something that you can now offer for your clients if you feel like they're the right fit based on what we've discussed today. Not required, just something else. This has been absolutely incredible. Doc, I really, really appreciate you taking the time to walk us through all this. There's still tons and tons of questions here. One of the things
that's exactly what I was looking at. There's so many questions that I want to answer.
Exactly.
Just rapid fire, I just want to say a couple things. Is that liraglutide is a daily medication. So we don't really use it because you have to use it every day, whereas the other ones are weekly. Tirzepatide, great weight loss, yes, is a GLP-1 GIP agonist. It tends to maybe, like I said, with semaglutide, it's about 16% the weight loss over time. Tirzepatide, we see about 20%. Common misconceptions: SBO is a mechanical obstruction, small bowel obstruction, or a large bowel obstruction. You don't get that with this. What we're talking about is ileus, which is the slow progression of foods through your gut. So it does not increase SBOs, LBOs. But I'm going to leave it at that because there's so many things I could talk about. But
yeah, I think there's definitely a follow-up webinar here. I'm sure there's going to be a lot more questions as people kind of come about here. Again, really appreciate the time here. Key message you can walk away with here. These things can work hand in hand to help your patients achieve the goals, the health outcomes that they're looking for. Health coaches, GLP-1s together for the right people. There's certainly an opportunity there. It does not mean that the other aspects of deep health aren't important. They're critically important, and that's actually what helps people move through the journey of using these medications onto building sustainable, healthy habits for the rest of their life. I appreciate all you attending. Dr. Yi, again, thank you very much. To the Orderly Meds team, thanks for the opportunity to partner with you. And with that, everyone have a fantastic day.
Thank you, guys.
Cheers.